Hi everyone, and welcome to Making It on Mondays. Now I'm just going to check, excuse me, my setup. I think that I'm live. I'm just going to check my setup because last week I had a problem and I just want somebody to tell me that I'm live. So I'm just checking in with my team. They can tell me that I'm live, and then I'm going to go ahead and start our session today. So let me just shut down everything else. There we go. All good. Perfect. All right. So it looks like we are live, which is great. Hi, Amy. That's great. I'm so pleased because, as I say, last week I did a whole 40-minute session and Facebook said I was live, and then there was no session on the group. So that's great. Wonderful. So good to know. Thank you, Amy. All righty. So let's get started. We are doing today our Q&A session. And this Q&A session is the first one of 2022. And what we're going to be doing is really answering all your fertility related questions. But before we start, my name is Louise Jeffrey. For those of you that don't know, I'm an acupuncturist. I'm a practitioner of Chinese medicine. I'm a mindset coach, and I'm a hypnotherapist. And I have a passion for helping people to live and create the life they deserve to live. Apologies if I've got a bit of a croaky voice this morning. I've had a few allergies, so I might be clearing my throat a little bit as we go through. All right. So I'm wondering how 2022 has been for you all so far. I hope that it's been good. If you're on live, let me know how it's been for you in the comments box, and I'll try and I will try and keep and keep abreast of those comments as they come in. All right. So I'm wondering how 2022 has been for you so far. Even if you're on the recording rather than the live, please do let me know. I would love to know how it's been for you. For me, it's been pretty good. I had an amazing January, 2 wonderful holidays, and getting COVID in between, which was fine. It was pretty mild, so all things were good. We were in ISO together, my family and myself, for a good week, but it was good. All good. All right. So as I said, today's session is a Q&A where we answer any and all of your fertility related questions. Now, I've had a few questions sent in by people who can't make today's live session, and I've also prepared some of our most commonly asked questions. Excuse me. So hopefully I will be covering pretty much everything off today. So we're going to be spending about 40 minutes together today. And please feel free to let me know if you have any questions along the way. I'd also love for you to let me know in the comments box if there's anything that resonates with you or anything you don't understand. So as I say, whether you're on live or whether you're on the recording, just let me know. We're going to talk today about the timing of intercourse. We're going to talk about what to avoid in the second half of the cycle. We're going to talk about what else you can do, about diet, about stress, about sleep, about whether supplements are necessary. We're going to talk about whether to avoid coffee and alcohol. We're going to talk about toxins and their impact on fertility. Excuse me. And we're also going to talk about how to improve sperm health. We're going to talk a little bit about IVF. Someone sent in a couple of questions about IVF. We're going to talk about that as well. And then we'll also talk very briefly about acupuncture and Chinese herbs. So it seems like a lot. And I'm not going to go into a huge amount of detail on each of those topics, but I'm going to go into enough that will hopefully answer your questions. And as I say, it'll also potentially, hi Sarah, lovely to see you. It will also potentially spark some thoughts for you around particular topics that you can ask more questions, and we can kind of go into more detail on those if you want to. All right, so let's get started. This is the first question that got sent in for our live today. Somebody asked, how often should we be having sex during the cycle so that we can improve our chances of conceiving? Hi, Vanessa. Lovely to see you on. So this is a really interesting question. Now, what we know is that frequent sex improves the quality of the sperm in an ejaculate, while a few days abstinence, in other words, not actually having sex, actually increases the quantity of the sperm. Now, some doctors, some fertility doctors or IVF doctors will tell you to have sex every second day for your whole cycle. But for a lot of us, that can actually be a little bit impractical. For those of you that are trying to conceive, you'll know that having sex every day or every second day is just not really, practical, because we have really, really busy lives and we get tired. And in Chinese medicine, if a man has a low sperm count, then having sex too often is actually not helpful, and it can be depleting, right, of our kidney chi. So another approach to take is, if you know when you ovulate, then sex daily around this time, right, is actually recommended. Now, if you're not sure when you ovulate, then it's actually advisable to stick to that, having sex every second day. So if you've got a kind of irregular cycle, then you can do this, the sex every second day from when the period finishes. And you can continue for 10 days or even more if you've got a longer cycle. But generally what we say is, if you know when you ovulate, start 2 days before your predicted ovulation and continue to do every day, for about 5 or 6 days, and then you should pretty much cover it. Okay. Next question was, is there anything I should avoid in the second half of my cycle? In other words, that 2-week wait, which is post-ovulation or post-embryo transfer. Now, the 2 weeks that are post-ovulation or post-embryo transfer, if you're in an IVF cycle, it's really a key time. And we're generally focused in this period on calming the mind, reducing stress, maintaining implantation, obviously assuming that it's actually occurred. And what most IVF clinics will tell you about this period is to actually avoid a few things. One of them is strong fragrances. One of them is to avoid heating the uterine or the lower abdominal area too much, for example, with a hot water bottle. And generally, they'll also just tell you to avoid raising your body temperature too much, right? So a lot of IVF clinics will tell you to avoid exercise altogether. Now, in Chinese medicine, we also recommend, on top of this, that during the 2-week wait, that we don't get the uterine area exposed to too much cold as well, all right? So avoiding swimming in cold water, for example, or avoiding exposing the area on a cold day, right? What we want you to try and do is to keep the uterus warm and keep the blood flowing, but we don't want you to overheat it, right? We're also going to suggest in the 2-week wait that you try and rest as much as possible without being too sedentary, all right? And make sure that you get enough sleep. So, for example, short, gentle walks are absolutely fine, but we really don't want to get the heart rate up, anything above kind of 90 or 100. We really just want to keep ourselves gently moving and gently keeping the blood flowing and the energy flowing, but nothing too hectic. And another recommendation from a Chinese medicine point of view in the 2-week wait is to eat soft wintry soups and stews. And also, because that's good for our digestive health, and also to to really make sure that we, as I think I said before, that we rest enough so that we can reserve our chi for the development of the embryo. All right. Next question that we got asked, and we get asked this one a lot, is, can eating in a certain way or can nutrition help me when I'm trying to conceive? And the answer to this is yes. Your diet and your nutritional choices can absolutely support you on your fertility journey. Now, the number one thing that we get people to focus on with diet when it comes to fertility is to eat clean and eat whole. Because we know that optimal nutrition provides an optimal ovarian environment for the eggs during that critical maturation process. And when we're looking for optimal nutrition, we really need to be eating clean and eating whole and eating organic. All right. So I'm just going to share some tips with you around eating clean and eating whole and nutrition when it comes to fertility. The first one is to pick whole fiber-rich foods, right, that are unprocessed, right? And the reason that we do whole fiber-rich foods that are unprocessed is we really want to make sure that they're free from pesticides, from hormones, from preservatives, and from additives, okay? So in other words, we're asking you to eat organic where you can. Now, why would we do this? Because we obviously know that organic is more expensive and harder to select. Because what we do know is that pesticides can affect the delicate balance of our reproductive hormones, right? And they can affect male sperm production too. So if you can't eat organic, then make sure that you soak your non-peeled fruit and vegetables in warm water with a tablespoon of bicarb or apple cider vinegar for around 10 to 20 minutes before you eat or before you cook, all right? And what this will do is make sure that the pesticides are removed. So just make sure that you rinse them after soaking. All right. Now in TCM, in traditional Chinese medicine, we believe in eating a wide variety of tasty, fresh foods that are in season. And that includes healthy protein. Now, whether that's meat or vegetable sourced, it doesn't matter, but protein is really, really important. And the other thing that will tell you from a Chinese medicine point of view as well is to be careful about the amount of dairy and sugar that you eat when you're trying to conceive. Now, if you've got no problem digesting dairy, then you're good to have it, right? But we do suggest that you have full fat rather than low fat or fat free, because low fat and fat free are highly processed. But in Chinese medicine, we believe that too much dairy, all right, and too much sugar cause damp in the body. And what this does is it weakens the digestive system, right? So we're always suggesting reducing the intake of both of these. Now, this is even more important if you've got a weak stomach and spleen, or if you're prone to damp. And how would you know this? Well, your acupuncturist can let you know when she sees you or he sees you. Now, if you're partial to dairy or you've got a sweet tooth, then try choosing healthier non-dairy or natural sugar options wherever they're possible. So, for example, I've got a sweet tooth, and I like the taste of some dairy, but I don't really eat it, and I'm not, it's not particularly good for me. I'm prone to damp. So I will always look in the vegan section of Woolworths or Coles or the health food store, and they've got some really great like vegan chocolates, for example. There's lots of different options these days. So really clean eating and good stuff to have if you've got a sweet tooth. All right, and remember, if you're taking IVF medication, so if you're in a stim cycle, your body, but especially your liver, is really going to experience additional demands and additional physical demands on the body, because your body is having to deal with breaking down the drugs and the high levels of estrogen. So it's a really good idea to give the liver every bit of help that you can give it. And some of the tips, for that are avoiding alcohol and avoiding rich and fatty foods if you can. All right. So lots of fruit and vegetables with adequate protein. Really, really important. All right. So here's a question for you. Did you know that it takes 4.5 months from the time the follicle in your ovary starts to develop to the moment where the egg it contains is mature enough for ovulation? Right? So in terms of the overall nourishment of the eggs in the follicles, it's really advisable that you and your partner take about 3 to 4 months, if you can, before you start trying to conceive, to really focus on your nutrition, okay? Because it really can make a good impact in terms of supporting you through your fertility journey once you get to start that. All right, so here's another question we get asked a lot. What about supplements? Can they help me conceive? So what we do know is that deficiencies in certain vitamins and minerals can really negatively impact our fertility, right? And so when we're starting out on a fertility journey, or even later down the track, if it doesn't happen as quickly as we would like, then we always suggest consulting or seeing a health practitioner like a GP or a naturopath who can run some blood tests for you. And what they'll do is they'll run those blood tests to check if there's anything that your body may require, in terms of vitamins and minerals and supplements. Now, they're going to be checking for things like folic acid and other B vitamins, vitamin C, vitamin D, omega-3 fatty acids, antioxidants such as CoQ10, and of course, minerals such as zinc, iron, and iodine. Now, the reason we suggest getting a test and not just going out and purchasing all those supplements is that there may be some levels that are deficient and others that require more supplementing. Now, if you don't know of a naturopath, or if you're not sure of who to see, then just let us know in the comments box, and we will send you, someone that you can see. We can refer you to someone. All right. And obviously talk to your practitioner about different supplements and recommended dosages. They'll discuss that with you. All right. So here's an interesting question that we get asked a lot because it affects so many of us. Do I really need to stop drinking coffee and alcohol if I'm trying to conceive? Now, this is a really hot topic because for many of us, we feel like coffee and alcohol are really two of the most pleasurable things that we have in our lives, right? And in Australia, we've got a really, really strong coffee culture. Now, the problem here is that high caffeine intake is associated with infertility and increased miscarriage rates. Now, what we know is that even moderate coffee drinking, in other words, 1 to 3 cups per day, can actually reduce our fertility. So if you're a coffee lover, right, and let me know in the comments box below if you're a coffee lover. I'd love to hear from you. I'm a coffee lover. I love the smell of coffee, but unfortunately coffee doesn't love me, so I don't drink it anymore. But if you're a coffee lover, let me know. There's a few studies that we reference and that have been done, over the years with fertility and caffeine. There was a 1992 study done of about close to 2,000 women in America by the Yale University School of Medicine. And what it showed was it found that the risk of not conceiving for 12 months was 55% higher for women drinking 1 cup of coffee per day. And it was 100% higher for women drinking 1 to 3 cups of coffee per day. Okay, so you can see how quickly the risk jumps with each extra cup of coffee that we drink, right? And then when we look at alcohol, there was a study from the University of California that found that for women undergoing IVF, that alcohol consumption of 1 glass per day in the 3 months before their treatment actually reduced their success by nearly 3 times, right? And for men, alcohol consumption in the month before IVF reduced their chances of success by up to 8 times. So if you're undergoing IVF, and if you're trying to conceive naturally, we actually recommend that both men and women abstain from alcohol consumption for at least 1 month, right, before your egg collection. And this is really to maximize the effectiveness and success of your IVF procedure. All right. So all these stats and numbers and these research studies can really sound a bit gloomy, but they don't really have to. What we're actually suggesting is that reducing your caffeine intake to 1 to 2 coffees per week is fine, right? And Vanessa just asked, what about tea? I love tea. So do I, Vanessa. I love tea. Tea, we know that if we reduce our tea intake as well. Now remember that tea is really, a cup of tea is about 1/3 of the caffeine of a cup of coffee, right? I think it was like 75 milligrams of caffeine per cup of coffee and about 25 for a cup of tea. And if you can reduce your coffee to 1 to 2 coffees per week and 1 tea per day, this can really make a big difference to your chances of success. Now, if you've got a hot constitution, and Vanessa, I don't know if you've got a hot constitution. In other words, if you tend to run more hot than cold, if you feel thirsty a lot, or if you get hot and sweaty at night, then avoiding coffee altogether whilst you're trying to conceive is really recommended, right? And this is because caffeine is a stimulant and creates heat in the body and it dries the body fluids. So that's really not helpful for fertility. And caffeine is also diuretic, right? Which means we're often left feeling even more hydrated, okay, from tea and coffee. So alcohol is also heat forming. So we suggest reducing alcohol to a few units per week if you're trying to conceive. And if you love your wine, for example, then have that 1 glass. I think red wine, it's got more antioxidants than white. Have your 1 or 2 glasses per week, right? Or 2 half glasses per week and savor every moment. And that's really not going to make a huge impact. But, I think the tough thing is that for many of us, both alcohol and coffee are such a huge part of our culture. And we relate both of these things to connection with other people and to pleasure. And so giving them up can really leave us feeling deprived and disconnected. So for a lot of us, it's not as simple as just giving them up. But, we can look for healthier options, right? There's chai tea, if it's not got too much caffeine in it. There's herbal teas. There's other options if you like, a warm drink, then look for the other options in terms of teas, or coffees. Unfortunately, decaf also still creates a bit of heat in the system. And, alcohol, there's lots of alcohol-free versions around. I am amazed at all the alcohol-free options that in the last 2 years have just come onto the market. It's fantastic. All right. So I hope that answered your question, Vanessa, when you say, what about tea? All right, let's move on to another question that someone sent in. And I think a lot of us can relate to this. One of our people wrote, I'm really stressed about my fertility and I have a busy life. And will this affect my chances of conceiving? All right, so what we know is that stress is not helpful for fertility, right? Stress is not really helpful for any health condition. But it kind of makes sense if you think that for the whole of evolution, the body, when it gets into the stress response for extended periods of time, will focus less on our non-essential functions, like a reproduction, for example. Now, we also live in a world where stress is endemic in our society. So we almost become accustomed to living with stress, right? In fact, and this is the interesting thing, in some ways, being a superwoman right, or a super mum in this day and age is actually revered, right? And it's something that it's like the tail of the two frogs, or the tail of the frogs, right? The two frogs. It's like the tail of the frogs in the boiling water. If you put frogs in a pot of boiling water, they'll automatically jump out because it's too hot. But if you put them in a pot of cold water and you turn up the heat slowly, then they become accustomed to the heat as their new normal, and they don't jump out, and then it eventually kills them. Now, I don't actually know if this is true or not, or whether it's just an urban legend or an urban tale. But the point is that it highlights for us that kind of sense that we become accustomed to stress, and when you ask people, are you stressed? They go, well, I don't know, like, what is stress? It's very subjective, right? And stress doesn't just come in the form of our emotions, like, am I emotionally feeling happy or sad? It also comes in the form of toxicity to the body. So things like bad diet, too much alcohol, too much caffeine, medication, lack of sleep, running our lives at a fast pace, right? All these things I've just mentioned can raise our levels of cortisol and adrenaline and put the body in the stress response. So if we can't change our circumstance, we need to change our response, our body's response to the stress. What can we do to counteract the cortisol and the adrenaline in our body? Things like practicing meditation, yoga, breath work, cutting out caffeine, alcohol, having acupuncture. All of these things can help to bring our bodies out of the stress response and back into what we call parasympathetic nervous system dominance. Okay, and if you guys need any more information around stress and fertility, I've got lots of research studies I can share with you. But also, acupuncture is absolutely fantastic at reducing our levels of cortisol and adrenaline. Okay, so you'll talk to anyone who's had acupuncture, will tell you that they almost every single session they'll walk out feeling a lot calmer. If they were stressed when they walked in, they'll feel a lot calmer when they were walked out. All right. The next question we get asked a lot is, what else can I do to help myself and support my body in getting pregnant? Now, there are lots of things that you can do, right? We're just going to touch on a few of them. Now, remember we said that it takes 4.5 months from the time the follicle in your ovary starts to develop to the moment where the egg it contains is mature enough for ovulation, right? There's really a lot you can do during this time which can actually influence the development of that egg. So besides diet, which I've already discussed, besides getting enough sleep and reducing stress, something else that you can do is to reduce the toxicity in your environment. So why do we need to reduce the toxicity in our environment if we're trying to conceive? Well, mainly because chemicals in the environment like pesticides, insecticides, household cleaners, industry byproducts, all of these have been shown to reduce egg viability, right, and to deplete follicle numbers and to damage sperm. And there's certain research studies that have shown that it reduces IVF success rates, right? Exposure to industry byproducts and to pesticides. There was actually a study of Danish greenhouse workers that found that there was an unexpectedly high sperm count among the organic farmers, so those that weren't exposed to pesticides, and that the sperm count was more than twice as high in those men than in the control group of blue-collar workers, right? So what this suggests is that consuming organically grown foods can really enhance our fertility, all right? So how do we go about reducing toxicity in our environment without it feeling like this massive, insurmountable task? Well, the obvious ones are really to avoid exposures to chemicals in our house, right? And in our personal products, right? The great news is that there's a really good selection of clean household and personal products. And, like 10 years ago when I first came to Australia, in Woolworths and Coles, there was only like 1 or 2 different, really clean household and personal products, different brands. And, in the last 10 years, it's been amazing, right? Then almost half of the products in all the household cleaning and personal products aisles are clean household and personal products, which is great. So test out new ranges, new shampoos, new soaps, new cleaning products. All these little changes in your household are really going to make a big difference to the toxicity levels in your body and support you through your, through your fertility journey. Now, something else that you can do, excuse me, to support your body physically is engage in exercise. Now, obviously I said in the 2-week wait, we've got to be careful not to get our heart rate up too high, but doing regular exercise in the first part of your cycle, particularly something you enjoy, has really been shown to be helpful and beneficial to our health, and therefore to our fertility as well, because it increases our energy, it lifts our mood, it helps us sleep, helps us control our weight. Okay, but just remember that exercising too much, like in excess of 4+ hours per week of aerobic exercise, has actually been shown to reduce IVF success rates. So just be careful that you're not over-exercising. All right. Now, something else that you can do to support yourself, through your fertility journey and in achieving a pregnancy is acupuncture and Chinese herbs. Now, a lot of our clients often have questions when it comes to this. So I'm just going to spend a little bit of time discussing this topic in the context of what else can I do to help support myself on my fertility journey. So some of the most common questions we hear from IVF patients are, when should I start acupuncture and does it help? People also ask, if I'm about to start my first or subsequent IVF cycle, will acupuncture actually be of any benefit? And then people often ask as well, is there any research that backs up your recommendations? So let's start. Let's look at when do we start acupuncture and how many sessions, can be of benefit. Now, if you're going to use acupuncture to support you on your fertility journey, then it's advisable, if you can, for you to have it before and during the stimulation phase of the IVF cycle. Or if you're trying to conceive naturally, then as soon as possible, really. Now, it's what's really, really interesting is that what it seems to appear is that dose of acupuncture actually matters. And what we mean by that is it's how much acupuncture are you having before your embryo transfer in IVF or before your ovulation. Now, there was a recent meta-analysis that showed that there's actually a relationship between acupuncture treatment dose and clinical pregnancies. And what they saw is that higher dose acupuncture before embryo transfer in IVF actually showed a significant benefit and increased pregnancy rates, right? And then the studies where there were more than 3 treatments were performed, the clinical pregnancy rate actually significantly improved. Okay. So one review observed that acupuncture that was administered to IVF patients at a dose of 9 to 12 treatments prior to embryo transfer is actually associated with more live births, right? Okay. And that was really where the review analyzed the outcomes of more than 1,000 IVF cycles. Okay. And what it found as well was that people who were using a whole systems Chinese medicine approach, which is really acupuncture with or without the herbs, and with or without dietary and lifestyle advice, also were more likely to have a higher, positive outcome when it came to pregnancy. All right, and a whole systems Chinese medicine approach is really the one that we take at the acupuncture pregnancy clinics. All right, so when should you start? Like I said, ideally you come in at least 1 month before you start your IVF cycle or before you start trying to conceive naturally. But if this date is already passed, then don't worry, just come as soon as possible. There may be other issues that we need to address beforehand as well, relating to sleep or stress or digestion. So come as early as you can, all right? And ideally, we suggest coming bi-weekly for treatment. That's twice a week for 4 weeks prior to your IVF cycle. And then obviously during the first part of your cycle, so the medicated part of your IVF cycle or the first 2 weeks, you still come twice per week. But then once you get into your 2-week wait, then you're only going to come once, all right? And we may also use electroacupuncture and low-level laser therapy as well to support you in the first part of your cycle. All right, beautiful. So we also get asked this question, how does acupuncture actually work to improve pregnancy rates in IVF? Now, this is really something that we want to discover too. And we're hoping that some of our data that we collect and have collected over time is going to shed some light on this. But, some doctors think that acupuncture that's performed at the time of embryo transfer reduces any uterine contractions, which can really improve implantation rates. And there's some studies that support this theory, but there's others that actually don't. So what we know from a Chinese medicine perspective is that we really are focusing on acupuncture points that we believe from Chinese medicine perspective improve blood flow to the uterine area and to the ovaries. Okay, and we're using acupuncture points that that may have a moderating effect on the immune system and may help implantation, right? So some people also ask us whether acupuncture can actually help poor quality eggs. So if you're someone who has gone into an IVF cycle and you've had a poor response to IVF, then there's really little that acupuncture can do in the case of DNA damage related to the age of our eggs, because we know that obviously the DNA of the eggs gets impacted over time as we grow older. But we do know that looking after your general and reproductive health can really help to provide a good environment in which the eggs develop. Okay, so some IVF clinics suggest taking antioxidants, and we sometimes recommend Chinese herbs, but we only recommend Chinese herbs before and not during the IVF cycle, because we don't know yet much about the interactions between herbs and IVF medications, and so it's not advisable to combine them. You can take them in the second half of your cycle, post embryo transfer or post embryo transfer if you like. And you can take herbs throughout a natural conception cycle if you would choose to. And in some cases where a patient has completed three IVF cycles that have had a poor response, then their IVF doctor might agree that adding Chinese herbs might be applicable in the spirit of trying everything. But generally we say avoid taking herbs in the first part of your IVF cycle. All right, beautiful. So someone also asked if, and we often get asked this question in the clinic as well, if I've got other gynecological conditions like endometriosis or PCOS, can acupuncture help me? And the answer is yes, absolutely, can help support you if you've had a diagnosis of endometriosis and or PCOS. Endometriosis, for example, in Chinese medicine is considered to be a stagnation of blood or a stasis of blood in the uterus. So we're going to use herbs that we believe improve blood flow. Okay, so for women who've had surgery and don't want to have it again with endometriosis, or who don't want to have surgery at all, then we can put together an individualized program for you that will use acupuncture and Chinese herbs. Okay, and that will may help to improve the blood flow in your uterus and to improve pain, to hopefully support you through through your fertility journey if you've had that diagnosis. All right, now I'm looking at the time and I know I only have a few minutes left, so we're just going to briefly talk about sperm health, and then we're going to move on to the last question around IVF. The question that women often ask us is, is there anything my partner can do to improve his sperm health? The great news is, with some lifestyle and other changes, for a lot of men, they can really improve their sperm health for the better in just a few months. So things like reducing coffee and alcohol, stopping smoking, reducing or eliminating exposure to fumes or toxins, improving the quality of your sleep, improving your diet, all of these may have a positive impact on your sperm motility and morphology. And there are a number of IVF clinics, that use something called ICSI, or which is intracytoplasmic sperm injection. And some of the men who come to see us will say, my IVF specialist says it doesn't matter that my sperm are mostly the wrong shape, or they can't swim that well, or they can't fertilize the egg, because the embryologist is going to use ICSI, right, where they inject the sperm into the egg. So is it really necessary for me to have acupuncture? And we always say, but if rather we have lots of healthy sperm to choose from, rather we get you into the best possible health that we can, with the lifestyle changes and with the different treatments, if you choose to have them. We really want to try, if we can, to improve the vitality and the health of your sperm, before you even go into the IVF cycle. All right. And then we had another question that came in this morning. I think it was Kelly who asked, what are your thoughts on trying IVF after recurring miscarriages? Now, I'm assuming, Kelly, that you're talking about miscarriages from natural conception. If you're talking about moving on to IVF, my first question around that would have been, if there's been recurrent miscarriage, were any of the embryos tested? And wondering then if, any chromosomal, issues came to light. Now, if there were chromosomal, issues with the embryo that came to light, then it's definitely worthwhile looking at IVF, right? Because if it's a chromosomal issue, then they may be able to help through the use of PGD, which is pre-implantation genetic diagnosis, which is really where they're going to test those embryos. So they freeze the embryos that make it through to day 3 or day 5, and then they test them, or they screen them. And then obviously they take those ones out that have made it through the screening, and they put those back in. And then obviously your chances of having an embryo with a chromosomal issue is dramatically reduced. Okay, so I would say absolutely, if you have had recurring miscarriages, then it's definitely worthwhile going to talk to your IVF doctor as well. And, and then coming to talk to us in the clinic as well, and seeing how we can support you through, through your IVF journey as well. And if you're interested in herbs, in the latter part of your cycle or outside of that IVF cycle, then we can look at that too. All right, Kelly, I hope that answered your question. If you're on the recording, I don't think you're on the live now, but if you're on the recording, let me know if there's anything else that you'd like to know around that question too. That's pretty much it in terms of questions for today. I am coming to the end. It's coming right up to the 40-minute mark, so I've actually managed to finish in time, which is good because normally I'm so busy yakking on. Today we've talked about lots of things. We've talked about the timing of intercourse. We've talked about what to avoid in the second half of the cycle in the 2-week wait. We've talked about what else we can do, about diet, about stress, about sleep, about supplements. And we've talked about whether to avoid coffee and alcohol. We've talked about toxins in the environment and how they impact our fertility. We've talked about sperm health. We've talked about IVF. And we've also briefly touched on acupuncture and Chinese herbs and whether they can help support us. I hope that this session was interesting for you, and I hope there is nothing really fundamental that I've left out. If I have, as I say, whether you're on the live or on the recording, please feel free to leave a comment and let me know. Ask any further questions that you'd like to. And I'll be back next week, Monday, at the same time for our next Making It on Mondays. And I hope that you guys have a wonderful, healthy, beautiful week. And bye for now. I'll speak to you soon. Bye.